So RefluxStop is a new keyhole or laparoscopic surgical procedure that has recently come about to help people who suffer from acid reflux. And that's basically what it is. It involves implanting a little cube-shaped device onto the stomach. It takes about 40 minutes to do, and patients who have reflux wake up cured of reflux. It's that simple. So RefluxStop is a treatment for gastroesophageal reflux. As people will know, there are other surgical options for gastroesophageal reflux disease, ranging from the classical fundoplication or wrap operations, which involved wrapping the stomach around the esophagus. Then some years ago, we had the LINX implant, which is a magnetic ring which we place at the bottom of the esophagus, which again stops reflux. But the problem with these two treatments is both with the fundoplication wrap operation and with the LINX operation, one is actually creating a constriction on the esophagus or a narrowing. And inevitably that leads to a degree of difficulty in swallowing in the post-operative period. And that can last from days to months. The advantage of the RefluxStop surgical treatment for reflux is that we don't wrap anything around the esophagus. If there is a hiatus hernia, that is completely fixed at the operation, but then we implant this small cube. It's almost shaped like a dice on the top of the stomach. It's called the fundus. And there, by doing that, it bulks up the fundus and stops it from going back into the chest cavity. And that helps cure reflux. To date, there have been about 500 cases done worldwide with excellent results. And I'm proud to say that I've been one of the few chosen surgeons in the United Kingdom to offer this new surgery. Well, the main benefit of the RefluxStop treatment is that it will cure reflux like the other operations. So there's no difference in that in terms of the curing and improvement of reflux. But the clear advantage of RefluxStop is it doesn't create any of the problems in swallowing, which tend to occur with the traditional anti-reflux operations and also with the LINX anti-reflux operation. So with RefluxStop, you don't get problems with swallowing after surgery. And for that reason, it is ideal for those patients who suffer from reflux and also have poor motility. So some patients who have very severe acid reflux, also their esophagus is not contracting normally in a coordinated fashion. And by using RefluxStop, we can help these patients not only cure their reflux, but also get their motility back to its normal. So RefluxStop is done with laparoscopic or keyhole surgery, and patients can actually even go home the same day. After they go home, we encourage them to be up and about, walking around, and almost everybody can return to work within a week. Patients can resume sporting activities such as swimming, cycling, and running after 2 weeks, and they can return to the gym and do exercise and do contact sports after 6 weeks. So in terms of eligibility criteria, RefluxStop can be used for anybody who suffers with reflux. Typically, when we have patients with reflux and poor esophageal motility, often they're not able to undergo the LINX operation, and even sometimes with standard wrap operations, they are sometimes counseled not to undergo them if they have poor motility. And that's because in both operations, you're constricting the bottom end of the esophagus. However, with RefluxStop, because one doesn't do that, anybody with reflux and any degree of esophageal poor motility can undergo surgery. So the should we say the indications for RefluxStop are much wider than traditional anti-reflux surgery, because it allows us to offer surgery to patients who suffer from poor motility.